Hi, welcome everyone. Today I wanted to make a quick video about cupping therapy and kind of give some background information in regards to that. Um, I feel like cupping is very intimidating to people, and I just feel like there's not enough information out there about that. So I really want to provide a little session about just going over some basic information and then hopefully providing some education so that way it can be interesting and hopefully used as a part of your wellness and healthcare. Okay, so some of the information that we'll be going over is the history of cupping therapy, how cupping works, benefits of cupping, markings versus bruises, as well as cupping marks and what they mean, because they do actually have something behind them. We'll be going over technique and equipment that is used, as well as any contraindications and aftercare. Okay, starting with cupping, the history of cupping therapy. I feel like it's very connected to ancient Chinese medicine, and I believe that that's where a lot of the ideas and connection of cupping therapy comes from. But actually, and that's very true, and that's good, of course, because they have a beautiful idea and culture behind cupping therapy and the meridians and things like that, which is very beautiful. But it was also in ancient Egypt as well, in the Book of Ebers, which is like an oldest medical textbook. They do talk about using cupping therapy to help with any kind of health issues that might have been back then. As well as in the Islamic culture, they have what's called hijama, and that's considered that's bloodletting, which you can see right there down at the right. And they make these very small incisions, like probably like a paper cut, maybe something small like that, on the skin, and then they apply the cup, and then they apply the suction, which is going to, the idea is to draw out any toxins or any blood that would have toxins. And they do a really cool thing too with reading the blood and like its thickness and the color and what that can kind of tell you and give information about. So it's actually a really cool thing, but that's probably something I would not do. But I think just to show that the culture and how they use it as a part of health and wellness is really interesting. And in ancient Greece, Hippocrates actually used cupping therapy as well to help with any health related issues as well. So there's a little bit more behind cupping therapy and the history behind it and the many cultures that it actually was utilized in. Okay, so the next best thing to talk about is exactly how cupping works, right? Provide a little bit of information on how it works specifically, and it gives you an idea of what's going on when we do utilize cupping as a part of our therapy. So first it's going to work on 3 different levels. We're going to start with the negative pressure. So instead of like a downward pressure like in trigger point, with cupping therapy, we're bringing up tissue, right? It's negative pressure. It's kind of like suffocating out the tissue a little bit. And then as we're bringing up the tissue, we're separating those different layers of tissue and even reaching down into the muscular system as well and those muscle tissues. And we're separating all of that. It's kind of like a slinky, how you're just pulling up, 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 up. That's kind of what's happening underneath the cup. And then, and like you can see in that picture, how we're just lifting the tissue up. Then in that localized area, you're going to bring in vascular dilation, right? So we're bringing in blood flow to that localized cup and where that localized tissue is. And as we're bringing in blood flow, we're also creating an exchange of fluid. And we're bringing in hydration to tissue that might not have had that hydration before due to just lack of blood flow or like tightness in the tissue, lack of movement and fluidity that might not have been there before. So that's kind of the purpose of a cup. We're not pressing down, we're lifting up, we're separating layers of tissue, and then we're bringing in fluid exchange and we're rushing it into that spot so we can provide hydration to what might not have been there before. And I think that's really good to know about cupping therapy because it can be pretty intimidating, but when you see how it works step by step, and you kind of get an understanding of like, oh, okay, like that actually sounds pretty good for my tissue to become hydrated that might have been malnourished before or might have restricted of blood flow or restriction of lymph. And it kind of gives you a little bit more appreciation on exactly what's going on, and makes it pretty fun. Okay, so general benefits. I feel like these are the most common heard benefits about cupping therapy, like encourages circulation, alleviates adhesions, clears up congestion and stagnation, it lifts, it hydrates, it manipulates fascia. All these things I've listed here, I feel like are the most commonly heard benefits about cupping. But for me personally, I like to have a bigger understanding of things. So I want to know more specifics because I think that's more energizing about what you're learning. And I think it builds a stronger connection when we're just a little bit more specific. So on our next slide, we're going to do just that. We're going to get more specific. So we're going to be a little bit more specific in our benefits of cupping therapy because I think it makes it that much more exciting to be more specific and have a better connection. So when we think about our epithelial tissue, which is your most superficial layer, it's going to stimulate that circulation, it supports temperature regulation, and it desensitizes pain patterns. So like our nervous system, right? It's going to kind of decompress and release those sensitivity patterns that we might have had before. In our cardiovascular system, it's going to promote circulation and encourages venous return. So it's going to encourage that venous blood flow return, which we all want better blood flow and better circulation throughout our body, right? Because when we have good circulation, we're receiving oxygenated rich blood and we're going to have overall good healing. In our lymphatic system, it encourages lymphatic drainage. It overall affects the direction and movement of the lymphatic system, and it supports even a deeper level of lymphatic drainage. So sometimes we think of lymphatic drainage as very light. It's very even just getting goosebumps is something that can encourage lymph movement. It's so light and so superficial. But there's also different layers of our lymphatic, and cupping kind of reaches that little bit of a deeper level. In our muscular system, it promotes lengthening of tight muscle tissue, and it promotes muscle recovery, right? Because if we have really tight muscle tissue, we're lacking blood flow, we're lacking lymphatic system going through there, and cupping helps promote that muscle tissue healing. In our skeletal system, it relieves joint inflammation. This is really good for like anything, especially like around scar tissue, where there might have been a little bit of damage to the tissue, and helps encourage the directional flow of joints, especially around the joints. And it also helps with limited range of motion because if we can release that tissue, we can bring in blood flow, we're going to increase range of motion. And again, with our nervous system, it's going to provide a decompressive therapy, and it's going to be pretty relaxing because it's not a pressing motion, but it's an uplifting motion, and it can bring in relaxation and a lighter kind of sense of feeling. All right, this is like my most exciting thing to talk about and to educate about, because I think this is probably a big reason why people don't want to do cupping therapy is they're very intimidated about the markings that are left behind. And I often hear people say like, I don't want to look like I got beat up, or it looks like an octopus attacked me. And it's kind of funny, like the octopus thing, I can see that, but cupping marks are not bruises. They are not. So we'll look here first. Let's start with a bruise. So a bruise is actually a response to an injury, right? When you hit yourself or you stub your arm or your leg on something or whatever it may be, it's a response to an injury. It's actually painful to touch, right? You usually don't want to touch it. You don't want anybody touching it. And also, it changes throughout the healing process. And there's a difference because where the purple and blue is, that's oxygen fresh blood that's pooled under the skin, right? It's kind of like been hit and it's been traumatized, and it's just blood that kind of flashed in, and it's oxygen rich pooled blood under the skin. And then as it's healing, you're getting a yellow brown color, and that's just the body breaking down that hemoglobin and circulating it back into the system. So you can really see the difference between the bruise mark here. And then the cupping marks, though, they're very circular, right? Because we did a local response, right? They're kind of one colorish, but markings, cupping marks actually mean something, and we'll get into that later. But they're not a yellow brown. There's really no healing transition. They may be sensitive to the touch, but they shouldn't be painful. And they just kind of fade away over time. There's never really any healing process like a bruise where the body's breaking down that hemoglobin or transitioning it back into the lymphatic system. This is kind of just bringing it, just kind of is there. It tells us something. Cupping marks tell us something, and then they fade away. And so also, most importantly, bruises do not have the healing effects like cupping marks do, right? Cupping marks say a lot and they tell a story, but also the more often you receive cupping therapy, the more you're not going to have those same marks. And we're going to get into that more into the next slide. Okay? Awesome. Okay. Our next topic, cupping marks. They tell a story, and an actually pretty good story as well. So we can see here on the picture down below the different kind of cupping marks that would be there. I know it's not really well depicted on what would be on tissue, but I mean, you kind of get an idea. And the colors to the left is kind of what it shows and what it would tell a therapist when they provide cupping therapy. So like a light red to pink would be like more superficial stagnation. It's something kind of fresh, something kind of new, and any kind of restrictions there. You see a dark red or purple. That's something that I think is really seen more often and is what makes it intimidating, but it just shows an older, deeper stagnation. So an older, deeper lack of blood flow and circulation within that area. A purple raised with like little deposits within the cupping mark would show like toxins and any other kind of like old stagnation and things that are trying to come through in just like little spots. Gray would signify like any release of smoke. Maybe someone is a smoker or someone is around smoke pretty often. And yellow is something that you would see more a little bit around old scar tissues and things like that. It's a stagnation of lymph. White or no color at all would kind of be like poor circulation, or also a deficiency in qi, right? Lack of our energy and flow throughout our system. Bringing it back to the ancient Chinese medicine. And then green, which is very rare, would be like a release of old medication or any other kind of toxins. And something to know about these cupping marks, I think probably the most popular are the first three, like the light red to pink, you have your dark red to purple, and then your purple with little raised dots. Those are probably the most seen. But as we've learned with cupping therapy, the whole process of how it works, when you uplift tissue, you're bringing in vascular dilation and you're bringing in an exchange of fluid. And the more often you do cupping therapy, the less often you're going to have that severe stagnation. So something that I like to think of it as is like when it's raining. Right, and we haven't, say it's been really dry and we get this flash flood of rain. And if the sewage system and the system around it can't handle it, we end up having still water, right? It's overflowing on the roads, it's all over the sidewalks, it's like stuck on the grass. We have still water because there was a lack of system of fluidity throughout that system to be able to take on that rush of of water. Now, if our sewage system can handle it and we get a flash flow of a flash of water, a big drop of water, of rain, it's going to be able to go through that system, the sewage system, well, right? Because it can handle it. Everything's cleared out. Everything can take on that rush of water. And that's exactly like what the tissue is. If it's been stuck and stagnant for a while, when you rush in that blood flow and that circulation, it's not used to it. It doesn't know how to handle it. So now we got to train the system and we got to apply cupping therapy a little bit more frequently. And as your body gets used to that cupping and as it has increased circulation and fluidity throughout your tissue, it's going to be able to handle that cupping response and handle that vasodilation, that circulatory system, and bringing in the lymph flow. So hopefully that makes sense. And I think that's really, really just important to understand and know that you don't have to do cupping all the time and you don't have to do it like every single day or whatever. But the more you implement it as a part of your health and wellness, you're going to get more fluidity and you're going to have less severe stagnation and more of that healthy blood flow circulation. Hopefully that makes sense. Okay. Another thing that I think is important to understand when it comes to cupping therapy is there's different techniques. So it all doesn't have to be very extreme. It doesn't have to be you don't have to always have marks neither. There's ways to manipulate it a little bit so that way you don't end up with as severe markings. It all just depends on what the goal is for the treatment. So techniques that there are is stationary cups, which is usually what leaves those one circular marks that we saw in the previous two slides. There's also moving and gliding cups, where it's just kind of a nice glide. You're moving. It's just kind of relaxing, almost like bringing in a Swedish massage and just creating that circulation and flow with moving and gliding cups. And then there's a lift and release. So we're going to put the cup on, we're going to lift up the tissue, then we're going to release it. So it's kind of like a pump, just bringing it in one spot, lifting, releasing, place, lift, release. Also, something that's important to understand is that different pressure can be applied with cups. Obviously, the more suction you have, the deeper the pressure, the lighter the suction, the lighter the pressure. So it doesn't have to be super intense. It can be something that's even very light and just relaxing. And even that still brings in benefits to tissue. So it doesn't have to be so extreme. And another thing to make note of is there's different equipment that's used for cupping. So we have like the silicone cups there to the left. Then we're going to go over to the plastic cups, and that still has like a little pump gun there, and it has like a little cord, so that way if you wanted to apply moving cups. We all know glass for fire cupping, and then there's actually little face cups, which is really nice because it increases circulation throughout our face, and it's actually really nice, and I would suggest it to anybody at least one time. It feels amazing because if you think about your sinuses and where everything drains, when you use cupping therapy for the face, which would not leave marks like before because it would be super light. This face is so sensitive. I mean, you would not end up with marks like that unless you intentionally left the cup there, but hopefully your therapist doesn't. But you would create movements with the small little face cups, and that's actually really nice, again, because if you think about your sinuses, when you need things to drain, especially allergy season or whatever may be going on, you want that circulation throughout your face. So I would suggest trying that if you're kind of intimidated or new to cupping. That would be probably a really good place to start too. So different techniques and different equipment for different goals of a treatment. So something I really want to go over is contraindications for cupping therapy. I think it's important to know when is cupping good and when it should just be modified. So never over any open wounds, never over varicose veins, never over bulging or herniated discs, compromised joints, recent injuries such as sprains, strains, or real bruises. Um, Something I think is to discuss with your therapist your medical history and any medications that you're currently taking. There are medications like blood thinners that result in bruising pretty easily. And I think with that, it's something important to just discuss with your therapist and make sure that you're comfortable, or if there's modifications or whatever can be made, because cupping may still be an option. It just may need to be modified, or there just could be also a better alternative that could help you reach your healthcare goals. So again, it's just very, very important. Discuss with your therapist your medical history and your medications. Medications are pretty important. I think people underestimate medications a little bit. So discuss with your therapist. You guys can come up with an agreement on how to do a treatment, make modifications, or just find an alternative option. There's nothing wrong with that as well. All right. Aftercare. So after you've received cupping therapy, there's care that should be implemented. Watch your hydration. Stay hydrated. Again, we uplifted tissue. We brought in some blood flow. We're creating circulation. We're hydrating tissue. The best thing is to also stay hydrated. I would even possibly maybe think about having something with like vitamins and minerals in it, to also implement that in a part of your water, what kind of drinks you may be into or find interesting available there. Also, limit your physical activity for at least 2 hours. I would honestly just limit my physical activity for the day, because I don't know, anytime I receive treatment, I don't really want to do anything for the rest of the day. But for sure, limit, after at least 2 hours, because you don't know how the tissue is going to respond. You don't know how you're going to feel. Some people do have an emotional release as well after cupping therapy. So it's important to just monitor how you feel physically and emotionally and mentally as well. Also, just monitor your tissue's exposure to hot and cold, right? So after you receive cupping, you don't want to go outside in the wintertime when it's like below zero here sometimes with really cold wind chill, and expose that fresh tissue to extreme cold weather. Or to the opposite end, you don't want to expose it to extreme heat, right? Or direct sun. You don't want your getting a sunburn on your freshly hydrated and sensitive cupping mark. So it's best to just kind of monitor it, take care of it, and just treat it very nicely. And something also you can use is arnica cream or arnica oil. I would suggest the cream. You can find it at Walgreens for like $6 or $7. It does help with markings, and it helps the healing process along that. Arnica has good healing effects to it. So stay hydrated, watch your physical activity, and watch your tissue and to extreme temperatures, as well as just take it easy. Thank you for watching my video about cupping therapy. I hope this provided some pretty good information about it, and hopefully makes you feel a little bit more comfortable about implementing cupping therapy as a part of your health and wellness. If not, totally fine. There's plenty of other alternatives. If you have any questions, please feel free to reach out, and hopefully we can discuss this and make it a part of your care. Thank you very much. Bye. I always like to cite my information because I am not the expert. I am learning from many beneficial, more qualified experts. So I always like to give a little bit of credit and information about where I got this information from, and just give those people credit because I think it's important in the hard work that they're doing. Most of my information did come from Modern Cupping Therapy, a course that I took about 2-3 years ago. Very, very wonderful ladies who have really created this program that's absolutely astonishing and informational, and they're out in Florida. But again, here's my works cited. Feel free to check out anybody's information and read some of the articles that I was able to read as well, and look into modern cupping therapy and see what those ladies are about as well. Thanks.